Hi guys, welcome to our channel. So if you have stumbled upon our page and are watching this video, I'm assuming that you want to join radiology residency and want to get some information about it. So something about myself first of all. My name is Sachin Kumar and I did my MBBS from Calcutta National Medical College in Kolkata and subsequently went on to do my MD in radio diagnosis from JIPMER in Pondicherry. So as an undergraduate, I think we have very limited exposure to this field and most of our exposure is limited to reading up x-rays, x-ray films and max to max CTs during our medicine posting. So even during our internship, I think in most of the cases, in most of the colleges, the radiology posting gets sidelined and in most cases, as we know, it just gets bunked. So I think there lies the problem. Very little people have full on clarity of thoughts on whether they want to take radiology or they want to make a career out of it. When someone gets a really high rank in post graduation, and by the way congratulations for it, so and every subject is on the table, things become downright confusing if you're not sure about what subject to take. I remember like 4 years back when I got a rank in JIPMER, it was so confusing because I was constantly having a tussle between shall I take medicine, shall I take radiology, and I'm really thankful that I met Dr. Rajat Jan and he let me shadow him on in his hospital for around I think 1 week and he induced some clarity of thoughts in my mind. So this is precisely why I'm speaking to you in this video, why we are making this video. This is not to sway you into radiology, that radiology to bahut acha field hai, le hi lo. No, this is to give you an objective overview on what to expect when you take a radiology residency and what your life might be for the rest of your life. So let's begin. So let's talk about this field in general. A radiologist will look at the image of a patient and try to come up with a diagnosis, try to think what the pathology is. And those images are taken via a number of modalities. It can be x-rays or CTs, ultrasounds or MRI. Come to think of a radiologist as a doctor's doctor. A doctor, a clinician, will come to a radiologist with patient's findings, with a set of history and lab values, and the radiologist will see the images, try to correlate those findings and come up with a diagnosis. If not come up with the exact diagnosis, at least he will narrow down the list of differentials for the clinician. And it's not that the branch of radiology is just focused on diagnosing stuff. These days, interventional radiologists are doing a lot of interventions. They are doing CT guided biopsies, FNACs. We are putting grains in pleural effusions and ascites. And there's this often ill-conceived or misinformed notion about radiology that radiologists don't save lives. वो तो जान ही नहीं बचाते हैं. And that is completely untrue. There is a complete separate subspecialization in radiology of vascular interventionists who are putting coils in bleeding aneurysms. They are thrombolizing clots which are obstructing major vessels in brain. They are absolutely saving lives in emergency. And radiologists completely jaan bacha rahe hain, and it's just not interventionists. Even diagnostic radiology plays such a crucial role in saving lives, and I'll come to that later when we are discussing pros of radiology. So like any other branch, radiology has also its pros and cons. There's a flip side to every coin. So we'll discuss first the pros of radiology and we'll do it point wise. So number one is that radiology is a happy branch. There's this phrase somewhere I read which called certain branches as a road towards happiness branches. So R standing for radiology, O for ophthalmology, A for anesthesiology and D for dermatology. And I feel that it's perhaps true at least for radiology. It gives a good amount of work-life balance, and you're free to do anything after you're off. Like once you are off the duty, you are just off. You don't carry your work to the home most of the times. And although it's not true for residency though, like in residency your work-life balance can be completely off the charts. Like I remember my residency, there was literally no life in that work-life balance. But then as your career progresses, you can dictate the terms, like how much do you want to work. And if you have any other passion, let's just say you are interested in music, you want to do photography, then radiology is a great branch because you can pursue those passions. Second thing is, let's face it, few people are just not good with patient interaction, or they just don't like to interact with patients a lot. Sadly, a lot of medical students realize this in medical college, and they are simply puzzled. Also, in the hardcore clinical branches like medicine and surgery, there's a lot of running around in hospitals, and like you have to stand in the OR for hours, and there are certain people who just don't like to run around, who just don't like all that physical activity associated with it. So for those people, radiology is great. And I'm not saying that in radiology you don't have work. There's a lot of mental work, there's a lot of mental stress. But physically, yeah, it's not that taxing. Also, it is really good for those people who just like to figure things out. Like in there is a certain set of people who would rather read a really well written case sheet, know all the information about patients, and then see the image and figure the diagnosis out. I'm not saying that in radiology you don't have to take history. You have to go and talk to the patient, but then a general history will already be there, and you just have to refine that history. So in that sense, it's really good. Another thing is that radiology is a very tech heavy branch. If you like technology, if you like working with computers, and if you like to play around with settings, like we work with packs, and you can do a lot of stuff with images, then radiology is great for you. And technology is ever evolving. In this age, it will just grow. Radiology is also evolving. There are more and more amount of tech which is being added to radiology, and it's very exciting. Another pro is that radiology is a cranium to calcaneum branch. I'm not talking about subspecialties though, but in residency you are a general radiology resident, and it makes things really exciting. Like you have to know about every part in human body. You like 1 minute you might be reporting on a subdural hematoma on brain, and the next minute you might see a case with pulmonary edema. In the next moment you might diagnose as intestinal obstruction. While doing ultrasound, in a first semester scan, you are playing a crucial role in telling whether there is heartbeat in the baby or not. So all of that makes radiology great. And as I said before, for those people who are really not into the hardcore clinical stuff, clinical stuff, this I think makes a beautiful balance. You are very well there as a part of a team. Your role in diagnosis and management of the patient is there, but you are also being exempt from all the running around and all the hardcore stuff in the clinical fields which you don't like. So it's made for such people. Another thing is and money. So money should not be the most important factor when you take radiology. A lot of juniors say, "अरे बहुत पैसा है radiology में, पैसा ही पैसा है इसलिए radiology लेंगे." You should never do that. You should take a subject which you like. If you like surgery, if you love surgery, if you have always imagined to take surgery and be in the OR, you should not take radiology कि चलो radiology में तो बहुत जल्दी बहुत पैसा है ले लेते हैं. You should never do that. So, but एक चीज़ है कि in radiology the money is good. I'm not denying that, and it comes really fast. But then I think it plateaus also. If you don't have your own setup, if you are attached to some hospital, then the plateau of that income comes really fast. But in case of medicine, surgery, and other branches, I think those guys eventually might earn more than you. But then it depends, like how much money is sufficient. Like कितना भी पैसा किसी को कम नहीं पड़ता. And the pros, let's talk about cons of taking radiology. The potential cons that can be there. First of all is that if you have not made a very informed decision, if you have not thought it completely through, then you might regret it. You might miss the patient interaction when you'll constantly compare yourself with the peers in other clinical departments, and this happens a lot, because a lot of time what happens is that someone will be really interested in surgery. Let's just say that a guy wants to be a surgeon since the second year of his MBBS, and suddenly he tops a certain competitive exam, and then a lot of people will say कि अरे first rank आई है, who radiology की सीट कौन छोड़ता है, and then he takes up radiology. That guy will definitely regret taking radiology because he has not thought his decision through. As I said before, take the branch which you love. I have friends who had like top 100 rank in all India and they took OBGY, they took dermatology, they took medicine. Always do that. Never run after a wave कि radiology top करके radiology लेना है, ये बिल्कुल नहीं करना है. Do it when you really want to do it. Second thing is that radiology has a steep learning curve. It's not like medicine, it's not like other branches जहाँ पे from day one you are able to understand something. In radiology, on day one you will draw blank. You will see the ultrasound and you will be like ये क्या खराब TV चला दिया. This happens. So in the first 4 to 5 months you might become disillusioned that कुछ समझ में नहीं आ रहा. But eventually when you start realizing stuff, when you start to understand stuff, it becomes really interesting. As I said, it's a really interesting and it's a very intellectually stimulating branch. Another potential con can be that radiology has immense course load. You have to read about all the systems, all the pathologies, every type of cancers. So the amount of course load and reading that a radiology resident has to do is a lot. Not to say that other branches don't have it. Even in medicine you have to read a lot. In pathology also there's so much to read. Same goes for radiology. So if you are someone who does not like to read a lot, this branch might disillusion you. But then if you are into radiology, you like it, then obviously you will like to read it. So I don't think it's a con per se. And fourth con is referrals and dependency. So what it means is that after once you are done with MD radio diagnosis, you did your senior residency, and if you decide to do your own practice, you want to set up your own private centers, then you are somewhat dependent now on the clinicians to refer patients on you. This is the sad reality these days in India, that there's this thing about referrals and kickbacks, that clinicians generally will refer the patient to a radiologist, and that creates a problem. Not to undermine the importance of a good radiologist, because if you are really good at it, if you are really good in diagnosis, patients will come. But in initial phases of your career, this might create a problem. And last thing which I want to talk about is artificial intelligence. I don't know if it's much of a con, because few people say that AI will come and completely destroy diagnostic radiology, radiologists will go out of jobs, but I don't think that's going to happen. AI, I think, will be more of an adjunct to a radiologist. I think it's more of a pro, and you should not definitely see it as a con. Now let's talk about what is the future like once you are outside your residency, once you are past your MD or DNB. So there are various pathways. Either you can go and do a subspecialization, you can do DM or a fellowship in interventional radiology, you can go on and further subspecialize in diagnostic branches like MSK, neuroradiology and all. Second thing is that you can join as a senior resident and complete your 3 years of senior residency and join as a assistant professor if you are into that kind of route, if you want to go into academics. Third is you can join a corporate hospital. This is something I chose to do. I am currently a senior registrar in Kokilab in Dhirubhai Ambani Hospital in Bombay. Another thing is which you can do is you can work on doing your own setup. If you have that kind of capital, you can definitely do that, and that is really lucrative. And if you want to go abroad, if you want to settle abroad, then that's also an option. You can take up USMLE and apply for fellowship in US. You can take RANZER to settle in Australia, and you can do FRCR for UK. So all in all, radiology is a great branch, and every branch, let's just say that every branch in medicine is a great branch if you have passion for it. No branch is bad, but if you really like radiology, if you have got a rank, and you're getting it, definitely think about it and make an informed decision. I hope I've helped in giving some clarity of thoughts to you, and if it's so, kindly like the video, and if you would like more videos on this topic, if you have any questions, kindly comment. Thank you. Best of luck.